Hi, I'm Christopher Dye for Manhattan Classical Acupuncture here in my Union Square office in Manhattan. And today we're going to walk through a sample treatment so you can see what it's like when you come to see me. Okay, so for our treatment today I've invited a patient. Hello.
Hi.
And how it works is that with all good medicine, I feel like, starts with listening. So I start with an interview and I ask all sorts of questions to really get an idea of what's going on. So generally people come to me for chronic or acute pain, sports injuries, chronic pain, inflammation. They come to me for stress, infertility issues. People come for respiration or digestive issues too. A whole wide range of things. So let's nail that down. So what's the major thing you'd like me to focus on today?
I believe the main problem that I have today that I think I want to take care of is my headache.
So when people come to me with something, let's say, for example, a headache, it's not that I'm treating just headaches per se, but I'm treating that person individually. So I'll ask follow-up questions to see just how that's showing up for you. So with that in mind, is your headache more in the center of your head? Is it to the side, to the back?
It's more to the back.
Okay.
Yeah.
And what is that related to? Do you feel like it gets worse or better at a certain time of day, or with the temperature, with stress?
Sure. I believe it gets worse at nighttime after like a whole day of work, and also maybe the days when I don't wear my glasses that much.
Mm-hmm. Whatever it is, in Chinese medicine we have a few thousand years of really seeing how the body's interrelated. So I'll ask questions about respiration, about digestion, about sleep, and all of it comes together to give me the whole picture. So after I do that, then I might take the pulses in Chinese medicine. It gives us a sense of how blood circulation is going through the whole body, and that's very important for the healing process too. So once we've done that, I think we're ready to do a treatment. In Chinese medicine, we have Chinese massage, we have Chinese herbs, and we have Chinese acupuncture. And each of these are a complete system in and of themselves. So for my patients, we can have one of these, the massage, or the Chinese herbs, or the acupuncture, or in my case, I like to do all three in a single treatment, depending on what my patients need. So what we'll be doing is first some massage for my patients' neck and shoulders, and I'll be applying some essential oils, some Chinese herbs that actually are applied on the skin and go through the skin to the muscles, to the nerves, to every part of the body. And I pick these out specifically for each patient, so everyone gets their own unique custom formula for that treatment. So for today, I'll be using some Litsea, a wonderful Chinese berry that's very good for promoting blood circulation, and I'll just be applying a little bit of that, and I applied over acupuncture points. So the Chinese herbs have their therapeutic functions that we've discovered over the last few thousand years in Chinese medicine, and the Chinese points, acupuncture points as well, have their therapeutic functions, their personality. And sometimes an acupuncture point or an herb will affect an area of the body very far away from where you apply it. So for headaches, for example, there'll be points on the feet and on the ankles and on the legs that have powerful effects for the lower back, the middle back, and for the neck and shoulders for the head. Now, I don't just use a single acupuncture point or a single herb, but rather I mix together and apply different herbs and different acupuncture points and make sure that they all work together. So here now I'm applying a second essential oil. This one's ylang ylang, the flower of flowers, and that's going to work with the Litsea, work with the first herb I used, and together they'll be more specific for treating my patient than either one alone would be. And if someone else came in with a headache, or came in with the same sort of symptoms, they'd get a different treatment actually, because the specific way that those symptoms were showing up and the cause of that issue would be different for each person. And so my treatment has to address that. Okay, now we're ready for acupuncture. And the most important thing, of course, is to find the points. So I'll start with that in relation to anatomical landmarks. Here we are. The acupuncture points I use are sterile. They're stainless steel. They're only used a single time. And they're much thinner and finer than what other acupuncturists use. There we go. So once I find the point, I use the guide tube, there it is, and take a deep breath for me. There it is. Nothing to it. Acupuncture points send a message to the body, and whether it's blood circulation coming to that area, whether it's the muscle then relaxing, whether it's the immune system coming and responding, whether it's the nervous system then relaxing and harmonizing, acupuncture sends a really fantastic message to the body. After the treatment's over, I like to send my patients home with some homework. That can involve anything from Chinese dietary advice, to gentle stretches and exercises, to Chinese herbs, so you take the medicine home with you. So that's what my treatments are like. I'm Christopher Dye. This is Manhattan Classical Acupuncture here in Union Square in Manhattan.